Hello everyone, this is Dr. L. Kiran Kumar Reddy, Consultant Interventional Cardiologist at Apollo Spectra Hospitals, Amirpet, Hyderabad. Today I am going to brief on heart attack and the coronary stents. So coming to introduction, the heart is supplied by the coronary arteries. You are seeing here, this is the right side coronary artery. Here this is the left side coronary artery, where it is again divided into one more artery called left anterior descending artery, another is left circumflex artery. So the heart muscle is supplied by the two main blood vessels, that is left and right, and left side is again divided into two branches. And the left coronary artery is supplying almost 40 to 60% of the heart muscle, and right side supplies around 40% of the heart muscle. So this is the blood supply of the heart. So what is heart attack? How it occurs? Heart attack occurs due to atherosclerotic narrowing of the coronary blood vessels. What is meant by atherosclerotic narrowing? You are seeing here, this is the heart blood vessel. This is the inside of the heart blood vessel. So you are seeing here the accumulation of the fat leading to narrowing of the blood vessel and finally leading to obstruction of the blood vessel. So heart attack occurs due to this narrowing due to fat accumulation of the coronary blood vessels. So it results in a heart attack where the cardiac muscle will get damaged and impairment of the heart function will happen. So we classified this heart attack into acute and chronic. Acute means it's like emergency or urgency, where the patient suddenly develops the chest pain due to sudden obstruction of the heart blood vessel. Where we will call as chronic coronary syndrome, where there is gradual narrowing of the coronary blood vessel and eventually leading to complete occlusion of the blood vessel. So this acute coronary syndromes we will call as STEMI, ST elevation MI, NSTEMI, non-ST elevation MI, or unstable angina. These are the types of presentation in the acute heart attack. And chronic coronary syndromes we will call as chronic stable angina. So this is the process of atherosclerosis which starts from our childhood, where there is gradual accumulation of the fat by 20 years, and that is gradually accumulating and increasing in the amount in the coronary blood vessels, and finally eventually leading to the occlusion of the coronary blood vessel supplying the heart. So how it is different in acute and chronic scenarios? In acute coronary syndromes, there is usually these fat accumulations will be happening throughout our lifetime. So when there is an exacerbating factor like uncontrolled diabetes, very high blood pressure, excessive smoking, there is inflammation will go in the heart. Inflammation will appear in the heart. So those exacerbating factors, if it are there, this lipid plaque, wherever it is there, it suddenly ruptures. It suddenly ruptures like a volcano, and there are like coagulant factors is there. Over this rupture, the blood will get accumulated suddenly. The blood clot will form suddenly and leading to sudden occlusion of the blood vessel. This results in a sudden massive heart attack, which may causing chest pain, exacerbating chest pain like severe intensity chest pain, or difficulty in breathing, or sometimes leading to sudden cardiac arrest. The patient heart suddenly stops sometimes and the patient will die suddenly before reaching an hospital or without any symptoms. So this is one of the mechanism in acute coronary syndromes. And there is another mechanism called plaque erosion, where there is a slight tear in the intima where the blood clot slowly gets accumulated and cause further narrowing of the blood vessel. This scenario will be seen in the non-ST elevation MI or unstable angina. But this sudden plaque rupture and immediate clot formation will appear in ST elevation MI. Whereas in chronic coronary syndrome, like chronic stable angina, this will not happen. There is gradual accumulation of the fatty deposits in the blood vessels, and slowly the lumen will come very narrower, and finally completely occluded. So this is the difference between the acute heart attack and the chronic coronary syndromes. So what are the symptoms? The most common symptom is chest pain, difficulty in breathing, sometimes palpitations like increase in our heart rate or very bounding pulsations, giddiness and loss of consciousness, very fatigue due to inadequate pumping of the heart. Patient feel very fatigued, and patient may have sudden cardiac arrest without any symptoms. Patient will die suddenly also. Sometimes in elderly population, they may not experience these symptoms much. They may feel vague complaints like just sweatings or tiredness or just giddiness. These are the symptoms that may be seen in elderly and diabetes, and in females, the symptoms are less intense. So they may get unrecognized, and delay in the treatment will happen in this population. How will you diagnose heart attack? So whenever you have having chest pain, don't delay or don't neglect it for any other cause like gastric pain or something. So whatever chest pain you are having, you just go immediately and take his ECG in the nearby hospital. That will save your life. If you delay in getting an ECG, the time is muscle. So when you delay in time, your muscle is getting to damage. So if you delay, you will be more risk of developing more complications or lifelong. You have to live with heart muscle will get weakened, and you have to suffer with heart failure, or it may lead to sudden death also. So never delay. If one is having chest pain, go to a nearby hospital, get diagnosed with ECG. If it shows normal, you are at safer side. If is there any problem in the ECG, you will get immediate treatment without any delay. That will save your life. If there are doubtful changes on the ECG, then you can go for blood test called troponin test, which clearly identifies whether it is an acute heart attack or any other problem is there or not. It will differentiate from cardiac problems from other problems, other causes of chest pain. And we can also get 2D echocardiogram, where we can see the functioning of the heart muscle, whether it is normal or decreased, so that we can diagnose even this. But the prime important diagnostic test is ECG. A simple ECG can save your life. So don't neglect when you are having a chest pain or any other symptoms mentioned here. Okay, this is the things. So what are the risk factors? Why you will get these things? Where, in which population the heart attacks will get increased? Nowadays, heart attack is seen in every age group. Previously, it was thought it's only the disease of older age population, but nowadays it is seen in every age group. So diabetes is one of the biggest risk factor. So these people having diabetes are more likely, 2 to 4 times more likely to develop heart attack and die from heart diseases. So all diabetics should get regular health checkups and should be very cautious, and they should control their blood sugars very well. Then smoking, high blood pressure, high cholesterol, these are the other important risk factors for development of heart attacks. Then family history of heart disease. This is very important. Whomever, in which family there is a uh, uh, history of heart attack in less than 55 years in males and less than 65 years in females, they should be more cautious. Then physical, the liver risk factors are physical inactivity, completely sitting in front of monitors, not doing any exercise, and unhealthy food habits like fast foods, packed foods, storage foods. These are very unhealthy food habits. Substance abuse like cocaine and marijuana. Metabolic syndrome. This is one of the emerging risk factors where it is going to cause a lot of heart attacks in future. So one should be aware of this syndrome, like it is a combination of high blood pressure, high sugar levels, high cholesterol, And abdominal obesity is one of the important risk factor. That is visceral adiposity, we'll call it as one of the important risk factor which will lead to heart attack. So one should maintain their weight and should be fit. Then other newer risk factors like stress and anxiety, depression, poor sleep, air pollution, prolonged sitting, and like some hypercoagulability states where there is a high blood clotting tendency in some people, and chronic inflammatory disease, and birth coronary artery anomalies. These are the risk factors for developing heart attack. So what is the treatment when the patient is diagnosed with heart attack, whether it is like acute or a chronic coronary syndromes? What is the treatment? So the most important is one should know about the treatment in the acute heart attack where it is life saving. So whenever you are diagnosed to have acute heart attack, you will get an ECG. Based on ECG, the treatment will change immediately. What to do? So if ECG is showing ST elevation MI, this is called STEMI, then you will have two options, either drug therapy or percutaneous transluminal coronary angioplasty. That is also called as coronary stenting, where a small metallic tube called coronary stent is placed in the blocked vessel. Okay, so but among these two, like systemic, like drug or stent, which is better? All the trials showed in acute heart attack, coronary stenting is the better option than drug therapy, called a systemic thrombolysis, where we'll give a small injection where it specifically lyses, like dissolutes the clot in the blood vessels. So wherever there is no option of cath lab and coronary stenting, without delay in time, we should give them the drug therapy with thrombolytics. If there is a cath lab able to reach a cath lab facility within 90 to 120 minutes, this is the best choice. So the main treatment in acute heart attack is the either systemic thrombolysis or percutaneous transluminal coronary angioplasty. Before that, you will be given some loading doses like aspirin, clopidogrel, there is the blood thinners, and statins, anti-cholesterol agents. And this is the treatment. So what is coronary stent? It is a small metallic tube which is made up of cobalt chromium or cobalt platinum. This is a small metallic tube where it is already loaded over the balloon. So after the vessel is opened with a wire, the system is taken into the narrowed segment, and then it is inflated with the balloon which is mounted, the stent which is mounted on the balloon. It is inflated, and this metallic tube will get adhered to the walls of the blood vessels. See, here it is narrow. After keeping the stent, we enlarged the blocked vessel which is causing the normal blood flow. So this is the process of coronary stenting. Then there are a lot of additional techniques for achieving good result, like for achieving good stent expansion, and whether the result is achieved in a very proper way, where it has been attached very properly to the walls or not. So there are a lot of other techniques which guide us to achieving a better result in this scenario, like IVUS imaging, where we will use a special catheter to pass through the stent and see if the stent is properly deployed or properly seated on the vessel wall or there or not. We can see with either IVUS, which is a black and white image, or OCT colored image. We can analyze it either before and after. It will help in these two image guided angioplasty will help in lot of scenarios to achieve the proper result. And whenever there is called calcium, which is like cement like hard, in these cases we have to use additional techniques like rotablation, where we will drill that calcium with a special device called rotablator, or we can do with the orbital atherectomy. This is another mechanism. Or we can use where you can pass a balloon. We can keep a balloon and give ultrasound wave pulses where it lyses this calcium and give a proper way channel to place a stent and expand it properly. These are the additional techniques which can be used. And the newer treatment options nowadays is like drug coated balloons, where there is no metal frame. Over the balloon, the drug is coated over this balloon, and whenever we taken through the vessel, we properly prepare the vessel, like we should dilate with adequate balloons before deploying the drug coated balloons, and then we'll deploy the drug coated balloon. We will inflate the drug coated balloon, and the drug on the balloon is transferred to the vessel walls, and the drug get deposited in the vessel walls, which prevents the further atherosclerosis, further fat accumulation. It will prevent. This is the newer option, drug coated balloons. Nowadays in the stents, we are all using drug eluting stents only, which are the treatment of choice. Which there are a lot of options in the drug eluting stents. Everybody is using nowadays the drug eluting stents, where this metal is coated with the drug. After these all treatments, one should not forget that lifelong medical therapy after stenting is a must to prevent the recurrent cardiovascular events. To prevent further events, to prevent further heart attacks, you should take the necessary medication to avoid the recurrent events. This is a must. One should remember. After stenting, don't feel that the procedure is done, the vessel is opened, we don't have to take any medications. That is wrong. You should take the lifelong medical therapy to prevent the further events, otherwise all these will get again blocked. Then how do you can prevent? By maintaining a healthy lifestyle with healthy diet, with more fruits and vegetables, cereals, legumes, and food with low in saturated fats, high in poly and PUFA, and like omega-3 fatty acids, and reducing the meat, um, fish rich in omega-3 fish, which is better than meat. And you should follow regular exercise, at least 30 minutes per day or 150 minutes per week. And who are in obese, you should attempt weight loss in obesity. And then control of all the risk factors like diabetes, high sugars, hypertension like high BP, high cholesterol, and all other things should be controlled. Like if the patient is having renal artery disease or low hemoglobin, low blood, and having thyroid problems, all these should be corrected along simultaneously with this with these measures, so that you can, by controlling all these measures, you can reduce the incidence of heart attack. And completely avoid smoking, alcohol, and don't go for substance abuse, which are very dangerous. Regular health checkups are necessary. Who is having a family history of cardiac disease and all these mentioned risk factors, so it should be better to go for regular health checks, so that you can identify if any problem is there early, and you can manage appropriately to prevent the heart attacks. And complaints to medical therapy, what we already discussed. After stenting, you should comply to your medicines. You should not miss a single dose of your medicine. You should regularly take and should carry wherever you go. You carry your medicines and take at appropriate time prescribed. Necessary medications to be continued are like antiplatelets, we'll call as antiplatelets like blood thinners, and statins, which are anti-cholesterol agents, and other medications which are for management of your comorbidities like the mentioned risk factors. So this is enlightening talk for basic understanding of the heart attack and the management in heart attack. Thank you very much. This is Dr. L. Kiran Kumar Reddy, working as a consultant interventional cardiologist at Apollo Spectra Hospital, Samirpet. We are expertise in doing coronary stenting, all types like primary angioplasty in acute heart attacks and complex coronary interventions using all the mentioned techniques, device therapies like pacemakers, ICDs, structural heart interventions, peripheral interventions. Thank you, one and all. Thank you very much.